Welcome to Catch Her Spark with Jen Maldonado. These are conversations with women who are building meaningful careers, stepping into leadership, and designing life on their own.
Hello, everyone. I'm so excited today. We have Dr. Shannon Markus because she has spent her career in the room nobody wants to be in, the emergency department, at the worst moment of a stranger's life, right? Just imagine. But lately, she's been in a different kind of hard room too. One, she doesn't get to leave at the end of a shift, right? Shannon trained at Promo School of Medicine and then did her emergency medicine resident at Vanderbilt. So she has a lot of experience in that area. She added a fellowship in health policy and equity and an MPH focus on healthcare disparities because she noticed the same kind of patients kept showing up in her ER for reasons that started long before they ever walked through her doors. So that's being proactive, people. And here's what most people don't know. She also served as a site medical director and director of quality for a major Austin emergency department, right? Redesigning the system behind the care, not just delivering one patient at a time. So there's a lot that she has done in this world. And more recently, she is willing to share with us. She's been navigating something much more personal, her own journey with infertility. And this is not something she has to talk about publicly, and it's not easy to do so, but it's shaping what she wants to focus on now because she knows this is going to be highly valuable for all the women out there dealing with this situation. So she's using her voice and her medical background to speak more openly about a struggle so many women go through it quietly and often while still showing up every day for everybody else. So this is Dr. Shannon. She spent her whole career asking what caused the crisis in front of her and trying to fix it. So let's bring our proactive doctor, Dr. Shannon. How are you today?
I'm doing great. I really, really appreciate you having me on your podcast, and I'm excited to have a chat.
Yes, I mean, I you have an amazing story. I wanted to know the first thing because for me, being a doctor, it's a great commitment, right? Especially where in the type of environment you work, it's highly stressful. What inspired you to become a doctor?
So, some people like dress up in Halloween costumes when they're 8 years old and decide that they want to be a doctor right then, and then they go and fulfill their dreams. And that was my older brother. That was not me. I think I went through like wanting to be a fashion designer and then wanting to be a FBI intelligence agent. And then I wanted to do public health. And as I got older in my teenage years, I kind of knew I wanted to do something impactful that affected a lot of people. So whether that I was pretty close to pursuing sort of an intelligence career, which is kind of funny to think about in hindsight. But I knew I wanted to help people's lives on a large, broad scale. So I sort of settled on public health. And in doing my research about like how to achieve a public health career and how to, what the pathway to pursue it would be, I ended up becoming kind of accidentally more interested in medicine, and I recognized that a lot of really successful folks who had gone into the public health sphere were also physicians, and so how could I marry those two careers and sort of use them like synergistically? So that's kind of how I decided to pursue medicine, not really knowing like what my career would look like at the end of it all, whether that would be more in hospital or patient facing versus in a just a truly public health sphere, like at a state health department. So I got my MD degree, I got my master's of public health degree, and I did my fellowship in health equity and health policy, which still kind of spoke to those values that I still hold. And I think right now in my early career, as I sort of transition into mid-career physician, I still have that desire to pursue public health projects and kind of sprinkle those opportunities throughout my medicine career. I think it will always change, and I love that I have that option for my career to change as I change as a woman and as a person. But right now, I'm mostly in the hospital working ER shifts, but still doing some public health projects on the side.
Wow. So you're busy.
A little bit, a little bit.
But I love that. I have a question for you because most workplaces don't have real policies for something like equity in physicians. So how do you shift these policies to achieve the outcome? What do you saw that needed to be changed?
Yeah, so I could probably literally give a an hour-long lecture on that. But so I think it depends on where you're at in your organization. I think every position in the organization from the top to the bottom have individual opportunities to employ practices that address health inequities. So if that's, a single physician or a single person in an organization and you're noticing the same types of patients or types of clients or customers, whatever is relevant for your career, coming in or running into the same issues, start being that person, that little annoying person who asks the question of like, why does this keep happening? So for me, if just being when I was just quote unquote a individual physician in a larger organization, it's saying like, hey, I'm seeing a lot of people come from or who say who they live in this part of town, but they don't have uh, access to the bus system, or they're not able to make an appointment or what have you. You can get your social workers involved in asking like, what is going on in either this part of town or this subset of patients. For me, most of my career, I've had some sort of position, some sort of leadership position, whether that is in the quality realm or that is working on a hospital committee, or most notably, my role as the site medical director. Um, you have the opportunity to oversee quality improvement projects that do address these gaps in care. I teach the residents, the medical residents. I teach the medical students on a regular basis, and giving them lectures on like opening their eyes to these issues, because we really don't get trained. A lot of medical education is not around social injustices, right? It's around medical education. And so being that person who kind of opens their eyes and makes them aware of some of these issues, I think is the first step. And I've sort of done some operational addressing of issues, quality improvement projects, and then also teaching. Those are sort of the three prongs, I think, of what I've done recently.
Yes. Can you give me some examples? Because you are just tapping in one of the most important things when you see a pattern and you want to create a difference, right? It's not
Yeah.
only about treating, and that's something
Yeah.
that just caught my attention. Like, you're not sitting there to see, oh, yeah, we have these many patients. You're sitting here, hey, we have a pattern here. Let's make
Yeah.
a difference. Can you give me some example of some of the things you
Yeah. Yeah, so probably the most interesting example I can give you is I oversaw a project with a medical resident who um, we identified the patients who return to the ER the most often. Like, I'm
see?
not talking like they have uh, recurrent emergencies, right? They're approaching the ER with problems that are not necessarily emergency issues. And so these are patients who may be seen in an ER 9 or 10 times in 3 months. So a lot of times. And actually capturing those patients the next time they come in, meaning capturing, and maybe not the right word for the general audience, but meeting them in the room and saying, hey, I saw that you've been here multiple times. Did you mind filling out a survey about what's keeping you from accessing regular scheduled care with your primary care doctor? Since we're not equipped to handle, chronic issues and stuff. So we did that over the course of the last 2 to 3 years, and have interviewed over 50 different patients who come to the ER because they don't have access to other care. And we've asked them individually what their individual situation is about what's their barrier to care. And the next step in that project is crunching that data, which we have done, and assessing it and trying to create interventions that says, okay, there's a subset of people who it's a knowledge issue, like they actually didn't know that they have a primary care doctor assigned to them. It's a transportation issue. Can we work with the city of Austin to address this gap in public transportation, or maybe even the city's ability to actually transport people for medical reasons? There's a program for that. So it's a really exciting project. It's been done in other cities, different variations of this type of assessment, but I think it's really, really important to kind of get a sense for like who your people are and what their individual barriers are. And then secondly, trying to figure out how you can address those specific barriers.
Yeah, I love that. I mean, that's being definitely proactive, right? It's defining the real challenge for these people, helping them get access to other resources that they did not have an idea they might
Mhm.
have.
Yeah.
And I love the fact that your team is taking the time to figure out what's going on, right? It start with those steps to show people that you care. And I think
Hmm.
that's part of the healthcare, right? The
Hmm.
care, I think that a lot of hospitals and a lot of people out there are feeling incongruent on
Hmm.
the kind of care they get because they feel more as the health and I'm a number instead of people caring. And I bet that they appreciate your efforts and your team efforts.
Yeah.
That's amazing. So you have take these challenges and start finding solutions, and you're passing this down
Mhm.
to other residency students. Um, have you get any feedback from them on how you're helping them on seeing things from a different perspective?
Yeah. Fortunately, we get pretty direct feedback from the medical students and residents, for better or for worse. But I get anonymous feedback very frequently about the attention to individual patients' needs, which it's nice to get feedback and positive feedback, but that's not the core reason I'm doing it. I think the core reason that we should all be paying attention to the people we serve is that that's the whole point, is to improve someone else's life and not just serve yourself. So I think that's the reason why most physicians and other healthcare professionals enter our careers. I think sometimes it can get, unfortunately, very lost in the stressors of what it's
Yes.
like to be a part of the very dysfunctional healthcare machine in America. But keeping that core value and being able to act in ways that are consistent with your internal values, I think is really rewarding. And it's been like well recognized that if we're unable to do that because of outside pressures, whether that's from your healthcare system or just the fact that people are struggling in the US and we can't help everyone, it leads to what people have termed as moral injury. Um, and I think, I listen to a lot of podcasts and I read a lot of news articles and content in general. And I think that phrase really resonates with a lot of doctors and nurses, I'm sure other healthcare and other professionals. Moral injury. My way to try to prevent the moral injury that leads to burnout is to continue to do those, like those projects and those smaller things that don't like suck my energy, that increase my energy and excitement about like helping people rather than just feeling like I'm a cog in the wheel of the machine.
Yes. Oh my God. Oh my God. Now, you're talking about machines, the process, and it looks to me that you have built a career advocating for people who don't have a voice in the system. Now that, and you shared this with me, you're living through something deeply personal that a lot of women go through in silence. What made you decide to use your own story to advocate for women instead of keeping it private, like the infertility situation?
Yeah. I don't know. I don't think it was ever like a very specific decision for me.
Mm,
Um, I always think I'm going to stay stoic during these conversations and I might, I might cry. But
so good.
yeah, so like taking it back, I grew up in a household with a very, very strong mother, and she um kind of soldiered through life and did what she needed to do to kind of change the trajectory of my family's life. And I know a lot of like I come from an immigrant family, so I know a lot of immigrant families and maybe even not immigrant families can say the same, where your parents like made sacrifices to and worked extremely hard to like change what their kids and their kids' lives would be like. And she did that, and she did that very well. But I will say there wasn't a lot of like emotional conversation, in my life growing up. And I became a person who was also that way, who was also like, put your head down, work very hard, achieve what you want to or need to achieve, and the fluff can just go to the background. So it served me very well because I went through very rigorous medical training. I enjoyed it. Um, I did well, but when I graduated residency was the time that I decided I wanted to start a family, which was a surprise to me and a surprise to my husband because we previously didn't want a family. And things changed, and we ended up agreeing to start trying to have a family, and it was not going well. And I experienced my first pregnancy loss, and then my second, and then my third. And it became a really emotionally intense and traumatic experience for me. So my whole life I spent not, trying to not be emotional, trying to survive in like a medical and very intense and high intensity establishment in the ER that is still relatively male dominated. And now I'm in this situation where I'm like barely hanging on by a thread because I've experienced so much, pregnancy trauma. Um, my I think like nature took over and I just needed to express myself. So I actually became like quite public. I wouldn't say public, but open with my infertility journey on my social media accounts. I don't have like any sort of crazy social media following. It's just my extended friends and family and everyone I've ever met in my life, like everyone else. But I started getting so many responses from that, just from other women and even men who had family members, including like their wives, who had experienced either pregnancy loss or infertility. And everyone said, "Thank you so much for talking about this." And so I think I would just be remiss not to mention it here because I don't think I would have the mentality that I do about my time and my money and my worth if it hadn't been for the last 5 years of my life. I think I would have been a wholly different person. So that's kind of the reason I say it's such a big part of my story because I was not like what I am now 5 years ago.
Yeah. So what changed? Tell me, the things that really I can imagine that it was very painful to and traumatic to go through every moment. What was going through your head, and how do you shift it to make you stronger today and become an advocate of
Yeah.
infertility situations?
Yeah. Um, I think what shifted is that I was so in the rat race that I didn't even know it. Um, I was so my concept of what it meant to succeed was 100% having to do with career and money. I wasn't like money hungry, but I definitely wanted to like get promoted. I wanted to be the medical director of an emergency department. I wanted to progress in my career, and that was extremely important to me. And I'm not saying that's wrong for that to be important to people at all, but having what happened to me happen pulled me so far from that world, in terms of like the daily um mental like exercises of what it took to like feel like a human. And what I mean by that is like I wasn't I was so affected by my inability to get and stay pregnant that it changed my priorities. That's what I mean. It made it very, very important that like your job is just a job. Like if you're miscarrying at work, which I did multiple times, and no one knew that, this isn't and shouldn't be my whole life. That's how I felt. Um, when I would spend, hours and hours and hours on whatever operational project or bottom line. And then I had to like go back home and be very sad and depressed about my personal situation. It just felt like that juxtaposition of working so hard for this organization or entity, and yet I'm here suffering. It just felt misaligned with where I wanted to be. And it's no fault of like the organization or my hospital or my colleagues. It was just very eye-opening for me about like what's important in life. And that was my marriage, and that was my family, my best friends, and my physical health. And those just shot up in prioritization for me. So, and work came down. Like I I think I recalibrated like what feeds me, um, like what feeds my happiness. And that is accomplishing good things at work, but accomplishing good things maybe is less promotion and more helping people than it was. And less like seeing patients, as many patients as I can, and more like getting good teaching feedback. So it just shifted things a lot for me and allowed me to like see where I wanted my life to go with much more clarity than if I hadn't gone through that. I think I would still be like grinding away as the site director, whether or not I was happy doing it. I think I would have convinced myself that I was, because it's a respectable role to be in, rather than something that maybe truly made me happy.
Yeah, I love that. So you go through a transition in careers where you were grinding and going for the achievements and the accolades that comes with professional achievement, to a place where you, as a woman, Dr. Shannon needs to recalibrate to find fulfillment and happiness on her own right. And
Yeah.
because of that, you recalibrate to make a more holy life.
Yeah.
And I think that that is super critical, especially for a women, with your business and your expectations. And I do expectations because you have a big dreams. You're a big dreamer. You're making big changes. Now, how does your relationship and your partners support you in making these changes? And I ask this because I know there's a lot of women that sometimes feel guilty because they want to achieve more, do more, and then they start finding that their family and their relationships and their personal life will suffer if they decide to go that. How do you recalibrate that?
Yeah.
How does your partner or supportive partner helps you manage these situations?
Yeah. Luckily, I have a husband who is extremely supportive of anything I want to do.
Mm.
We met when we met a long time ago, almost half my life, which is kind of crazy, but we met when I was 21, and I was going to medical school at that time. So he already knew sort of my career trajectory and knew sort of what he was getting into. But he was always extremely supportive of my ambition. And I think more notably is not like any lack of support, but more like holding a mirror up is what he's done throughout the years. And he's been like, you're really achieving a lot, but are you happy? He's always been that person. He's like, you kind of seem a little unhappy with this, whatever one job or one place or the folks that you're working with, whatever it is, he won't hesitate to point that out. And I think that's helpful because again, I'm like very driven, very ambitious, and I've always thought like, no, I'm achieving things. Of course this is the right thing. And sometimes it takes one person going, you're not acting like you're very excited about going in today, to for me to recognize that. So that's been really helpful for me. And sort of on a larger scale, he he is not very ambitious. And I don't say that as a bad thing at all. Actually, I say that as it's took me at least 5 years of our early relationship to appreciate this, but it is a whole different way of thinking about life and what it means to be successful and what it means to be happy. And if you were to ask me when I was 21, what is my ultimate goal in life? It would have been something like, oh, I hope to achieve as much as possible and help as many people as possible, bright-eyed and bushy-tailed. And then for him, even at that age, was, oh, I just want to be happy.
Yeah.
And it's been, consistent throughout our lives. If something isn't suiting him, he is easy to discard it. Because his outlook is, why suffer if this is not serving me? And not in a selfish way, but in a like, am I happy with this way? And I've learned a lot from that. And so through the hard times, like the dark, last, I would say 2001 to 2000. I mean, sorry, 2021 to 2024 were extremely challenging for me and for us. And I think he was there the whole time saying, this is already hard enough. Let's figure out what's going to serve you and what's going to make you happier. And I think those two things together, like the trauma, the infertility, and his voice, have helped me get to where I am today.
I love that. So pretty much he gave you ground to keep it because you were already dreaming and flying, and
Yeah.
he gave you the ground you needed as a supportive partner and provide that balance.
Yeah.
And I think that a lot of ambitious women have found that that's very important in their lives, right? Because they
Yeah.
don't need more ambition; they have enough on their own.
Yeah. Yeah, yeah, exactly. And and what that looks like now though is like I still am very ambitious, but I think it's spread more evenly across the different like domains of my life. Whereas like my ambition was really just like career focused before. So happy ending to my infertility journey is that we were able to produce embryos, and
Mhm.
I did IVF multiple times, and so we had embryos, and we really, I mean, it was a deep personal loss for me um, to admit and accept that I would not be able to carry a child. And so that's why it took so much perseverance with IVF and failure for me to eventually switch gears. But we did eventually switch gears in 2024, and since then we've had two babies via surrogacy. So our embryos. So at the end of the day, we still got our children that we always wanted and cherished. I just wasn't able to carry them. And so now my ambition is like, I want to be present. I want to be a good mom. But like I also want to work out 3-4 times a week. And I also want to have meaning in my career. Um, and there's, I'm sure, several other things, but those are probably the biggest things: is be there for my children and my husband, take care of my body, and find meaning in my work. And so I had stepped away from the medical director and quality director role. They were just taking every inch of my life up, and I wasn't getting the return on happiness as I wanted to. So I now I do very specific projects that I find meaning in. So like I'm on the hospital system, the wider statewide system ethics committee, and I deal with medical ethics cases as they come up. And like I have a meeting today in a couple hours about a patient who's incapacitated and has no one to make medical decisions. And we come together and have these really deep discussions about like what the right thing to do would be for this patient in the situation that they're in. And this is a regular occurrence in my life. So that's really nice that I get that longitudinal experience. Of course, I have my shifts. I see patients every shift. Obviously, I had multiple shifts in the last few days, and there are a lot of really grateful people out there. And then one other thing I do that I find meaning in is I'm the representative for our large trauma hospital to make sure that we're ready for any children to come in, and it's called pediatric readiness, and it's just a position that essentially you make sure that you have all the supplies and all the education and all the right preparation for really sick little kids to come in into what is typically a mostly adult hospital, and so just making sure like you said it earlier, which I never thought about this, but you said that it sounds like in my career I've um, found positions where I can help people who don't have a voice. And I definitely think the ethics committee and the pediatric position speak to that. And it's kind of cool that you said that because I hadn't thought of that way. So that's helpful.
Yes, it took me a few minutes to read through the story and say, oh my God, this girl is about advocacy, standing for people who doesn't have a voice and making those changes. Since you brought that up, where do you think that's coming from, Dr. Shannon?
Oh, that's a good question. I don't know if I have like, I don't know if I have a clear answer for that. I think, I'm not very head in the clouds. I like to be very pragmatic with how I think and what I say, but I do think that this is maybe just one of those things that you just want or you don't, like you have or you don't. And I've, like I said, like when I was 16 and 17 and thinking about what I wanted my college major to be, I either wanted to like protect our country with FBI intelligence or be a public health officer. I'm like, I don't know where that came from. I don't know. I don't know where that came from, but I mean, I think definitely my upbringing, like my family has always, I mean, they've always been so giving and instilled like when you're in a position to help others, you should, like that's what you're going to do. Almost like an expectation. And so I'm sure that has something to do with it. But it's just been something that's always resonated with me to focus in on health equity and making sure that people have like opportunities just like everyone else.
Yeah, it sounds to me that that's what it makes your job meaningful to you.
Yeah. Oh yeah,
So
for sure. Yeah, I don't think I could do like VIP medicine or anything. I couldn't do it.
I love it.
I don't think I'm cut out for that.
Yes. I mean, it sounds to me that you have found your niche and what you're
Yeah.
passionate about, advocacy and
Yeah.
finding different ways to change the system and serve people that otherwise they won't have the opportunity to access resources and,
Yeah.
get the care they need. So I love that.
Yeah.
And
Thank
through
you.
your own journey, you have gone through this and you have recalibrate yourself to find your priorities and what matters to you. And
Yeah.
I think that's very important for the busy women out there, career driven, which there's nothing wrong, but it's good to take one time and stop and recalibrate their lives and see what's
Mhm.
important because we go through transitions in life, right? And
Mhm.
things changes and what used to be super important is just reshaping, taking a new transformation on
Yeah.
how does that look. I love that. I love that. Now, I have a couple of questions. We're getting to the
Yeah.
end. I want to ask you so many questions,
That's
but
okay.
one of the biggest challenges when I'm talking to my friends about fertility IVF is how do you support economically these process surrogation IVF because the system here, the care system doesn't help you a lot when it comes to that. I have been talking to Korean friends and they have so many resources. Do
Yeah.
you find any resources here that help you? Or sometimes I have friends, some of my friends, they are into the investing world and they were
Yeah.
investing and using some of those money. do you have any ideas for women out there that might be limited on resources, how they can approach this?
Yeah, I know that in the last, 5 to 10 years, a lot of companies, and not just like companies that have only high earning employees, a lot of companies are offering things like egg freezing, and some fertility support. So I think the number one way would be to, if you have like career mobility, to uh, try to find a company that has an insurance policy that can cover some of fertility costs. That's number one. Um, Unfortunately, I think the way our healthcare system in our country is set up it's very difficult for people to be able to afford these things. Um, People have taken out personal loans. People can consider international surrogacy, actually. Um, it's much cheaper. You always obviously have to research the risks and the legal process that comes with each individual country's surrogacy laws, but that is a possibility. Um, and family and friends may be able to help. And then just for us, it was a little bit of all of those things. And then one of the biggest things actually was one day I just remember being totally fed up with the anxiety that came with the big price tag of making that jump between trying to continue IVF for me, which is expensive, to surrogacy, which is way more expensive, which was just the money concerns. And eventually I just said, like, along the same lines of like realizing like what's going to make me happy in life is like, why don't we just use our savings? Like, I know we decided not to touch it, but like, what's the point of having savings if you're unhappy? And I really came to that point. Like I remember where I was standing in my house and just crying and saying like, let's just do it. And I'm so glad we did. So we used a lot of savings. We were so fortunate to have some help from a family member for some of it. And then I did take on extra shifts, extra, uh, out of like it's called PRN, working opportunities. Like I just worked harder and I just buried myself in my work, to make more money to afford it, because I just knew that it was going to be something that if I didn't do everything I could, I would regret it later. And so we just did literally everything we could to pull together what we needed to make it happen.
I love that. I love that. You really went for it. That's where your ambition shifted. Listen, it's no matter
Yeah,
what.
yeah, yeah,
I love
and
it.
yeah.
Yeah,
Mhm.
thank you for sharing that. I mean, that's something that is very, I know it's a vulnerable topic, right?
Mhm.
And
Mhm.
I know a lot of women out there, they're struggling with it, going through situations like yours, and they don't know who to talk to, right?
Yeah,
And if they don't have a supportive partner, it's even more challenging. So,
yeah, for sure.
um, if women or any other person want to reach you out, what is the best way to connect with you, Dr. Shannon?
Yeah, you can reach out to me via LinkedIn. And then I think you have my professional email, which I'm happy to share that with people who reach out. Yeah, I'm happy to chat about, career opportunities or career advice. Yeah,
Yeah, awesome. Well, thank you so much, Dr. Shannon, for sharing your story, for being with us, and give us a couple of tips on how to recalibrate your life when life
yeah,
make you change priorities.
yeah, yeah, for sure. Well, it's been my pleasure. I appreciate you having me.
You've been listening to Catch Her Spark with Jen Maldonado, where bold women lead the way. Ready to share your spark? Apply to be a guest at catcherspark.com/guest.